there have been sharp rises in COVID infection rates in some parts of Cambridgeshire. It's thought the Delta variant, which was first detected in India, is spreading across the county from neighbouring Bedford, which is a national hotspot. Nathan Albon can tell us a bit more. Nathan, run us through the latest figures.
Yeah, well, there are, as you say, some sharp rises across Cambridgeshire. It must be said it is a bit of a mixed picture, but concern at the moment looks like it's aimed at Cambridge, where the infection rate's more than doubled in a week, South Cambridgeshire, where it's more than trebled in a week, and in Huntingdonshire, where it's more than quadrupled in a week even, and that's for the week to Saturday the 29th of May, so a little delay on the data that we get in. It must be said these rises are from a very low base. They were very low rates, particularly compared with some parts of England, but they are starting to creep up. For example, Huntingdonshire now 16 cases per 100,000 people, up from 3 just a week ago. But this does compare with Blackburn, which is the highest in England, at 436. So a big difference. The national average at the moment around 32 cases per 100,000 people. Meanwhile, we have seen week-on-week falls in Peterborough and East Cambridgeshire, and in Fenland it stayed around the same. So, yeah, as I say, a bit of a mixed picture.
And what's the thinking on why we're seeing some of these rises?
Well, I mean, I'm no virus expert, but of course the virus can spread over borders. And as you say, Bedford at the moment, a particular national hotspot. I think it ranks 5th out of over 300 areas in England for that infection rate. And with Cambridgeshire neighbouring Bedfordshire, which is one of the main problem areas, particularly for this Delta variant first found in India at the moment, it wouldn't be a surprise to see that this Delta variant is spreading more rapidly through Cambridgeshire. And it may just happen to be the case, or that might be a direct link, but Kimbolton, Great Staunton and Molesworth in Huntingdonshire is currently Cambridgeshire's COVID hotspot, and that area specifically is right on the doorstep to Bedfordshire. So that area's recorded 4 COVID cases in a week and has an infection rate nearly double the national average. When we look at the Delta variant, we've had 10 cases confirmed in Cambridgeshire for the week to the 22nd of May. That's the latest data we have, so again a good deal of lag on that as well, and that accounts for around 21% of COVID cases analysed in Cambridgeshire for that week. So only a small fraction really, but as I say, a bit of lag on the data that could have since risen.
And I guess the real worry has to be, Nathan, if cases start rising, but also if hospitalisations and the number of people who are dying starts rising again. How worried should we be?
Well, this is it. You're right. As I said, the rates in Cambridgeshire are still well below the national average. National average 32 cases per 100,000 people. Peterborough, the highest in Cambridgeshire at 17, so nearly half the national average, really. But yeah, with some rates creeping up, it is a bit of a concern. But yeah, these the vaccination rollout and the hospital figures are very important to look at, because the vaccine definitely is protecting a large proportion of the population. And the latest data we have from Cambridgeshire's hospitals is that the number of COVID patients is still falling down to about 10 now, down from over 600 at the January peak. So the situation a lot better than it has been. And in fact, no COVID patients at all at Addenbrooke's Hospital in Cambridge. So there are reasons to be positive going forward, and the vaccination programme is certainly one of those to be cheerful about.
Absolutely. Nathan, thank you very much for your time. Nathan Albon there, bringing us up to date with those latest COVID numbers.